I can see everyone's very, very compliant, right? Everybody's sitting down. I'm going to ask several people to come on up. Jerry Wengerd, would you come on up? Dennis Koch, are you here? Where's Dennis? Come on up. And Steve Elson and Senella, if you all would come on up.
Which was in the dark ages. It's been a long time.
My name is Cook. Don't look at it. Don't look how it's spelled. It'll throw you on. Cook like you're doing your breakfast.
Got it. Got it.
I think I remember it.
There's a castle with his name in Wales, which I visited. I said, I finally figured out how to pronounce his name. Well,
I remember the book.
you can't even do a hard. How you doing?
Get through it.
Goodwin, while you all are sitting down, which I know everybody's going to be sitting down within seconds, I have, as usual, a few housekeeping details I need to share with you all. If you are interested in continuing education credits for today, you can get those at the registration desk. So anybody who wants continuing education credits, go to the registration desk during the break and you can do that. If you are paying for parking, if you go to the front desk, it's less. It's only $9 instead of whatever else it is. And I know you're dying to know where lunch is. Lunch will be in this room. And then the breakout rooms for this afternoon, when we have the 3 breakouts, the Dale Jarvis presentation will be in this room, and the 2 breakout rooms are over by the registration desk. And the names are listed in the program. So one other thing I wanted to tell you is that because we know many people would like to go to all 3 of the breakouts, we are recording them all. So we will have those recordings available later, and they'll be up on our website, and you can download them from there. So with that, I'm going to ask, this looks like a lineup, doesn't it? We are very fortunate to have these organizations all sponsoring today's event. So I'm going to ask you all to introduce yourselves and welcome us and tell us a little bit about your organization.
Good morning, I'm Jerry Wengerd with Mental Health Directors, and I'm from Riverside County. I want to welcome you all. We had no time to practice, so we didn't do anything together like dance or sing. They didn't give us chairs, so we're not allowed to be here very long. So that's the way it is. Things are changing. We have a great lineup today. I know you've seen the program. It's extraordinary for one day to have all these people that we get to see and talk to. So I'm looking forward to it. In Riverside, we're busy doing a couple things, trying to get ready. We're doing what everyone knows is an integrated care. My medical director is with me this morning. He's led that project. We are integrating mental health, our mental health workers, some in teams, into primary care clinics. That's one of the big things. We're doing quite a few things. But the only reason I wanted to say that is we're in such a year of change. This is all about change. Everybody I talk to in every organization says, wow, you know, the state's changing. We're still dealing with that. We're still not anywhere near done with all the changes in state administration. We're dealing with ourselves now, and we're dealing with we're dealing with the healthcare reform. We've got, what, all of 11 months left before we're all ready to go and all started up and have everybody we need and all that kind of stuff. So I welcome you today. Look around. This is our, this is our community here. We're mental health directors. You all, some of you are, and some of you are from the contractors. Some of you are drug and alcohol administrators, and we all do the same thing, and we're all doing it with the same people. So this is our community, and when we think politically, we need to think about us as a large group and not us just as a small group. So that's it for me. I'm going to let my old buddy Dennis take over now from Fresno.
Did he say old? Yeah. Long-term buddy, yeah. In fact, Jerry hired me. May regret it, other people. Well, welcome here. I'm Dennis Koch. I'm the president of CADPAAC, County Alcohol and Drug Administrators Association of California. And more importantly, I come from the Central Valley, and that is Fresno, one of the most outstanding counties in the valley. We know people like to come there for vacations in July and August, and we welcome that. We like the revenue from our hotels, and we tend to have vacancies in July and August, so come. The water's nice. As we get into healthcare reform, I saw how it, and first of all, there was like 4 of us, like a batting lineup for baseball, and me and Jerry's job as batter 1 and 2 is to get on base. And hopefully we don't have to steal, and the last 2 guys will hit us home, put the pressure on them. As we come into healthcare reform, I know the topic today is understanding, and I don't know if that's understanding to learn or understanding in the sense to have sympathy or empathy with someone and to understand and walk with them. Because I know they're trying to put these pieces together. It's kind of like making a model in the dark. It seems like there's more that we don't know than what we do know, and hopefully after today we'll understand more pieces of that. I know the County Alcohol and Drug Administrators were excited about the idea to maybe have some increased benefits under our insurance Medi-Cal carve-out, drug Medi-Cal. Our benefits are really 3, individual, group, and 1 medication. And so we think there might be some opportunities for more there. That's tempered with the financial risks that come along with that. As fast as healthcare reform is going to get here, year 4, where there's going to be some match, is going to get here just about as quick. It seems like the day after we implement healthcare reform, we'll be trying to figure out how we're going to match some of the federal dollars there. Because a lot of times in substance use disorder, when we effectively treat those people, the cost savings don't come to us. Our cost savings are felt in child welfare, criminal justice, and hospital ERs. So the better we do with helping people to become symptom-free on substance use disorders, the more cost savings that goes into those other systems. And sometimes they're a little bit stingy on reinvesting those funds back into our system of care. I, like Jerry, say, welcome here, look around. Hopefully after today, I was thinking, geez, after today we'll understand. And I then got into reality. And the reality is we'll probably end up having more questions as we're learning and walking through this process. I know a lot of people are depending on us figuring this out and implementing a plan that we're able to fold the benefits under a Medicaid expansion and the other components of the Affordable Care Act into our current system of care. So that'll be challenging, no doubt. Anyway, welcome here today.
Good morning. My name is Steve Elson. I'm the CEO of Casa Pacifica Centers for Children and Families. We are in Santa Barbara and Ventura counties. More importantly, for purposes of this meeting, I'm president of California Council of Community Mental Health Agencies. We're an association of private nonprofit providers, mental health providers, who are probably delivering services in most counties, not probably, we are delivering services in most counties in California. Our members range from small agencies with budgets of a couple million up to agencies with over 100 million who are statewide. So we're delighted to be here. I want to thank Sandra Goodwin and her team for putting together a really timely, relevant program for us, and we're delighted to partner with the counties and the entire mental health stakeholder community on behalf of the kids, families, and adults that we all serve. You know, by the way, today is February 14th. Happy Valentine's Day. Lily Tomlin once said, if love is the answer, can we rephrase the question? So that's kind of why we're here today, to rephrase the questions and learn a lot about what's coming down the pike. So we appreciate the opportunity to be here and to learn together. And welcome to you all. Enjoy the conference.
Good morning. My name is Senella. I'm the president of the California Association of Alcohol and Drug Program Executives, otherwise referred to as CADPAAC. The association is the largest representing the field of substance use, but it's a bit misleading because our membership makes up providers who do just substance use, who do substance use mental health, who do substance use mental health and primary care, as I think many other mental health agencies do in today's world. These are, of course, some exciting times, some uncertain times, even perhaps scary times. From the standpoint of policy, which is what I think today's discussions are about, helping to inform policy, is one of the areas where I think it runs the gamut from exciting to uncertain to scary. There are folks, the decision makers out there that make the policy. There are those that reach out and want stakeholder input. There are those that don't reach out, may get stakeholder input anyhow. And in both cases, it's uncertain what they may do with it, sometimes scary what they decide to do with it. But I guess my 2 points on this is that from a recent example, we are clearly better united than we are apart. In a recent proposal from the administration last year to eliminate the State Department of Alcohol and Drug Programs, that proposal had it being busted up into a number of pieces going in several different directions. But because of a united position on what made the most sense for the field, the administration did a complete about-face in this year's budget proposal, with it all going to one department, Health Services. So it's an example of what happens, I think, when there's consensus, and I'm hopeful that in today's debates about health care reform, which everybody is racing around to try to figure out what will the final decisions be come January 2014, we can remain united with a very strong voice about what's best for all our fields. Thank you.